Good day, ladies and gentlemen. This is Dr. Suleiman Lalani. I do internal medicine and geriatrics in Sugar Land and Greater Houston area. Today, I am here with my good friend, Dr. Ali, who is board certified in infectious disease. Also, he's the chief of medicine at Houston Methodist Sugar Land Hospital, a physician leader, good volunteer in the community, person with a great heart. I see that he was rounding in the hospital, but still found some time to be with us. As a physician, we are on 24/7. And let me take this opportunity also to give a big shout out to our physicians, all healthcare people, all the first responders. Kudos to them. COVID-19 has taken humanity hostage all across the globe. And we all are trying to manage what the best we can do. Millions of people affecting. But it's still 80-20 rules applies here too, as we know that 80% of people who are being affected or exposed would not even know or have any symptoms. 20% will have some symptoms. What experts say is about 15% can be managed outpatient, 6% end up in the hospital, 1% in ICU. So even in a big picture, this is not very bad. But one preventive life lost is one too many. So we need to do best what we can do. Dr. Ali, welcome today.
Thank you. Thank you, Dr. Lally.
So I wanted to ask you, our topic today with life in COVID times, testing, what we know, fears, fact, and the reopening that is happening from the lockdown. So what would be the best practices? First of all, tell me, the people should get out and be back to normal lives or stay home?
Just going and reviewing all the COVID cases in the past that we've done within the past 2 and 3 months, we've noticed that this is something to look at and to consider, that this is a pandemic that is in front of us. So in your questions, going back to a normal lifestyle, I don't think we'll come back to that anytime soon. The fact that in the hospitals we see the cases, people are sick, people are dying. There's some people who do recover and do very well, but we're always worried that one person dying is too much for us. However, just with the world opening back up, people need to take this in consideration, that it is something that a disease that you cannot see who has it, who doesn't have it. There are a lot of patients that we see in the hospital that are asymptomatic. They're carriers. They come in because they have been screened positive. We watch them. We usually discharge them from the ER, or we would discharge them in the 24 hours and tell them to self-quarantine at home. Now, there are other people who have not tested, so they may be the silent carriers. And when you go out and open the world up, you're posing a risk on a lot of these young kids as well as healthy adults and geriatricians that will give you that kind of the scariness, and the patients who would end up in the hospital worse. Now, I think going back and moving towards the world being open, I think it's going to be the one that CDC recommends, that, hey, you need to do it with cautious, with wearing a mask, you as well as everyone around you.
What would be the best practices in lieu of reopening?
Opening in the small scale is the right way of doing it, because that would limit your interaction with people, as well as the problem being is people need to understand that this is serious. This is not some kind of a joke that people, as soon as the world opens up, then they rush out to do things. You need to understand that this is a very serious disease itself, and you could end up in the hospital, let alone on life support.
So it's still the same things, like wash your hands frequently, disinfect the surfaces that you often touch, wear masks, be out if you have to be out, practice good infection control, still stays the same.
Oh, absolutely. That is bread and butter. So you would have to do that kind of stuff in order to survive in this kind of practice. The fact that if you don't have to go out, I would not go out. That's number one, understood. Now, if you are those people that need to work, that have dependency, that you need to go out, wear a mask. Make sure other people around you are wearing a mask. if there is people or friends that are sick, I would stay away from them because we don't know what this is. You know, we don't know if this is COVID or if this is flu or if this is other illness.
That was my
Just
next
to be safe
question.
is better.
That was my next question. Who are the high risk people that should be extra careful?
So, you know, in the hospital, we've seen so many patients, and initially we felt that elderly people were most vulnerable to get the infections. However, I feel that anyone can get this infection, and it is the comorbid conditions. If you have diabetes, high blood pressure, any kind of cardiac issues, congestive heart failure, those are the people that get sick fast, and then they go down pretty fast. Uh, my experience has been that the young and very healthy are the ones that have a bad disease. They do have high grade fevers, they have severe flu like symptoms. However, they are the ones who do very well. You know, that's based upon seeing patients. Now, we have had cases where the young also get sick also, and they end up on life support. However, they do well and they come off of life support and they get discharged. We haven't seen any pediatrics. So at Methodist Sugarland, we don't see pediatrics. At least I've not encountered ones, but I've been up to date on New York cases about the cases that have been coming up with the kids, as well as the issues that they're dealing with. I think you would see them. And maybe in Japan, maybe in China, all these places where they were hit hard, you'll probably see them more as well.
So we see, since we are talking on the disease, usually we'll say dry cough, fever, malaise, shortness of breath, but we are also seeing unusual symptoms. There are case studies, young people showed up with stroke. There are studies, people have come with heart attack, and there was a heart failure, acute cardiomyopathy, where we are seeing lack of taste or lack of smell, and that was so. What are some unusual symptoms that you have noticed in your practice?
So commonly symptoms are there 100% of the times. They're usually going to be there, but uncommon symptoms are like gastroenteritis. Patients come with nausea, vomiting, abdominal discomfort. I've had patients with high-grade fevers and headache and nothing else. We've encountered a recent case of a patient coming in with diabetic ketoacidosis who are uncontrolled diabetes, ended up in ICU, and we were wondering if this is truly COVID versus pneumonia secondary to aspiration because he was so obtunded. And we initially treated as pneumonia until he wasn't getting better and tested for COVID, and those were positive. So they're coming in with weird symptoms. Some patients don't have symptoms at all.
So in short, if you feel anything different, please consult the doctor. It may not be COVID.
Absolutely. And in looking at all this retrospectively, I would say that anything you have a feeling on, you feel that this is COVID, test them, because it's easier to test them and get a negative test results than worrying about it and trying to see if anyone's been exposed or not.
Good. Thinking about testing, there are different types of testing happening. Some of those, a lot of places are doing, are they FDA approved, not FDA approved? Some that has false positive, specificity, sensitivity that we talked about is different. What is the difference between taking a swab, PCR? The name is very familiar. People talk about PCR testing. Then there was a test about serology, do the blood test, find out antibody. So talk about different type of testing, please.
So basically right now what they're doing is nasopharyngeal swab. Basically they take a swab, a Q-tip type of material, they swab up your nose. They have to go deep inside, and there's a technique on doing this. And you have to go deep enough and basically turn the swab for 20 seconds inside and collect the sample and send it off, which is your common PCR testing that we do, which is done pretty much everywhere.
It's not just a nasal tip, it has to be deep nasopharyngeal.
There is a technique behind it. I mean, personally, I have not done it, but when I've seen it being done by authorized people who do it, there is, and people who've got it done, they have also said that it is something that goes deep and it hurts. So it is not something that you just do a nostril swab and expect to get some results.
And there's some false positivity or
Oh,
negativity?
absolutely. So, there's cases that case studies will tell you, or the percentage will be about 70 to 80%. There are tests that are going to come back and miss those 20% of being positive. So it just depends, and it depends on a lot of variable. How you do the test, what technique you use, how much sample quantity you have, what is the transport time in getting the media into the lab, and things like that all make a big difference. So there's
It's an RNA virus, right? It's highly unstable virus.
Yes. Yes. So all that makes a very crucial thing to understand, that you are going to get false positives and false negatives as well. So what we do is, if you're high index of suspicion, where we know that patients have high degree of disease and we see certain parameters, fevers unclear, why are they coming, respiratory distress, requiring oxygen with no clear-cut answers. There are certain blood markers that we look at, inflammatory markers in the hospital. If we see all these elevated, despite having the first one negative, we will do a second test, okay, just to make a better presentation and make a better outcome course, saying that, okay, we've tested twice, the probability of 2 tests coming back negative is very hard, plus the fact that you have 2 different people collecting samples. So if there's a sample technique, there's 2 different people collecting it. So we do that. There's cases where the first one's negative, the second one just came back positive. So we've seen that quite a bit. Now, the serological test that I'm aware of is only that if you have antibodies to these. Now, if a patient is exposed to coronavirus, he or she does not have an idea if they have the COVID-19 or not because they're asymptomatic. They could go out and do a blood test, and we test his IgG levels, antibody levels, to see if the patient was exposed, clear of infection, yet has immunity towards it. And those are the people that we asked to donate blood so we could get the antibodies from them and try to transfuse to the really sick people.
But do we know that is that serology having that IgG, IgM antibodies, would they give them immunity? They're like, in hepatitis, for example, you can have the antibody, but you require a certain amount of titer to have the immunity. So in this case, is it just having it, or?
I've never seen the case firsthand to see if they're coming back with second COVID testing, or COVID coming back saying that if you had a positive test, you passed through it, you had antibody positive, and they're coming with a second phase of COVID. I've yet to see cases. I've heard of cases. I've read through about the cases. I've had come across where a patient is positive for IgG as a antibody, and also test positive for the PCR. So I've had 2 concurrent cases where both of them come back positive. However, patients are very asymptomatic. Yeah.
Now, were they symptomatic when the 2 tests, or they were asymptomatic?
They're asymptomatic. Yeah. But the thing is that even with the asymptomatic PCR positive, which is the diagnostic test these days, you're not sure how much are they transmitting, how much are they affecting other people. I don't think there is, at least I don't have the capability of judging, saying that, hey, you're at a very high risk of transmission to anyone and everyone, because how much virus do they shed? I don't know.
Also, you could be test negative one day and then you can get exposed in next few days and may become positive. So it shouldn't have a sense of false feeling that, oh, I'm negative, so I'm good to go.
Oh, yeah, absolutely. I mean, despite that, this is just like any other virus. If you get exposure to a flu-like patient or flu symptoms, you're going to get the flu. You may not react the same way. So this is just the same holds the speech for coronavirus, that if you are asymptomatic today and you go into a crowd who one person has COVID-19 and they start sneezing, coughing, touching objects, you touching them, you being around them, there is a probability you're going to catch it.
Gotcha. Talk about acute infection versus just exposure, and then we know that whole bunch of people who are exposed will not have symptoms. There are some people who will have mild symptoms and some will serious. So what is the infection versus exposure, and when somebody should think about calling their doctor?
So, if they come in with what we tell patients is flu-like symptoms. If they have flu-like symptoms, they don't have respiratory distress, they are naturally not, if they're exerting themselves, they're not getting short of breath, and they are young, healthy, that could hydrate themselves, we would tell them to stay quarantined, get yourself tested. However, you don't have to rush to the hospital in this case. Patients who we ask to rush to the hospital or come into the hospital are cases that are, you need the hospital services, such as oxygen, such as medication, high-grade fevers, which is uncontrollable, causing more problems. Any patients that have difficulty breathing. Those are the cases that we request them to come to the hospital.
So somebody who's asymptomatic went to a drive-through or public testing site and got positive. Now they're getting panicked. I'm positive. Should I go back home? Not go back home? What do I do?
So those are the ones that we recommend to go back home if they're asymptomatic, because
But to self-quarantine themselves.
self-quarantine them absolutely for 14 days. Showing up to the hospital just exposes themselves to a lot more stuff than they need. If they are able to quarantine themselves to confined to a room and not expose any loved ones or family members, that would be the ideal situation, because you don't want to end up with COVID-19 and catch another bacterial pneumonia sitting in the hospital, because you're in an area where there is a lot of infections. A lot of people are sick in the hospital.
Asymptomatic just had the test done because it was available, or they were concerned, or they were anxious. They got positive. Asymptomatic, go back home, but self-quarantine. Now
Self-quarantine.
for 14 days. Now, should they go back for a negative test again to get out in the community, or is it all right for 14 days?
No, so it depends on who you ask and who recommends. My always recommendation is to get tested again. Okay, just because the fact that we've seen cases that patients have been positive PCR for more than 14 days. They have tested positive even after 14 days and they stay asymptomatic. It comes back to my saying that I don't know how much virus are they shedding to infect anyone else. Just to be on the safe side, you should have at least a negative test just to get out. However, that means getting out with mask, with doing the social distancing, with everything what the CDC recommends. Not just because you've been positive once, you have the immunity, you could go out and just be without a mask. That's not what we've preached.
Okay. What about if they're mildly symptomatic? They can take some Tylenol at home for aches and pains or little fever. Or what can somebody can manage at home or not? Or what are the treatments available? Anything?
So anecdotal treatments are there. I mean, things that we've tried. Tylenol is the drug of choice for fevers. They tell you to avoid Motrin, aspirins, NSAIDs, those kind of things. We do also recommend zinc oxide or zinc sulfate, any kind of multivitamins, as well as just anything to break down fevers. If you even have to put ice pack on you, things like that. There is no other symptom or treatment that I could tell you that is out there that works. And people have their myths, people have things that they do, but I would do it only if you're certain that things are not going to harm you. But certain things you should do.
Plus, also the treatments which we are giving. And there were a whole big noise about chloroquine, Plaquenil, and then remdesivir has come. There are some other medications, but those are all still in trial and should be done in the hospitalized patient. Should not be given to outpatients.
Absolutely. In a controlled setting, because such as we used to do hydroxychloroquine, but we've every week we have updates and recommendations from Methodist Main Hospital, as well as CDC, as well as the WHO organizations. They give us recommendations based upon guidelines, based upon studies. We say this will work, this will not work. Right now, what we are doing is doing remdesivir for patients who we feel that are the right patients, early onset, we do go ahead and transfer them to Houston Methodist downtown, where they're doing the trial of remdesivir, as well as we are doing the plasma treatments here in Houston Methodist Sugarland Hospital.
Talk about future. What do you think, vaccines or any treatment coming up? Is that something in a matter of few months, to year, or is pure luck, or what are we talking about?
I'm hoping that there is a vaccination that comes out, because the way we see the world changing in front of us is kind of hard to imagine how life will be after this. Is it coming out in the near future? Based upon expert opinions and expert reviews, I would say you're about a year to a year and a half out to having any kind of a true vaccination. A lot of testings in phase 2 have been going on right now. I've been trying to keep eye on them. And are they promising? I don't know. I don't know the answer to that. I'm hoping that they come out soon. But realistically, I think you're about a year and a half out.
There was a lot of talk about second wave, and even if you look at the previous pandemics that had happened, that there was one wave, and then this, after a few months, the second one came. Is that a myth? Is that a fact? Do you think it's going to come, and as a matter of time? How severe? What to do? Are we prepared?
So I think it will, I personally think it will come. Severity might be a lot less because we have done this social distancing, and the fact that people, at least majority, are scared to step out. Majority are fearing this infection. People are the ones that are not fearing, ones who are not social distancing themselves, they're not wearing the mask. Those are the ones that are going to affect, and those are few of the population. So those are the ones that are going to come in with positive symptoms, positive findings. However, there's always a concern that these new people that get infected, they live with someone, they stay with someone, they might infect the elderly or the younger, and that might come through. I do see the future that we may see a surge of infections. I don't think, at least I hope it's not as bad as what we had initially. We are prepared to a point where the hospitals are prepared. We know what we're facing. The treatment-wise, I think it's still not available. You know, we don't know what works. I think supportive care is what we're giving, and we're hoping one of these drugs that are in trial is going to be the one that's going to help us out.
So I think a lot depends on time, that if we get the vaccine on time, if we get treatment on time, then the severity and people affecting of second wave will also depend on that too, right?
Absolutely, absolutely. And it's just like the influenza. People have the Tamiflu to treat it. People have the flu vaccinations to get a milder form of this thing. So I'm hoping that with the vaccination, that it changes the whole paradigm of the COVID-19, that people don't fear it. It'll be like, yes, there will be a wave coming in, but people will fight through that wave.
My last question would be that there are places, there are countries, there were no lockdown, or there were lockdown was eased and they came back. How did they fare in it? Any lessons learned? How should we look for?
So we do see that different places that have opened up, there is cases. I think it's still a lesson to be ongoing learning and seeing what did they do wrong and how fast did they open up and what they opened up. So a lot of these places where they opened up completely or to a very high degree of opening up, we've seen cases that have come up, but a lot of these understanding is that people are getting tested more. So you're going to see a surge of cases just based upon the fact that you're testing more people. Now, we've yet to see these patients end up in the hospital and get sick. So up until that data doesn't come out, we won't know that are they truly the ones that are asymptomatic getting tested, and those are the ones that we're catching now, versus the ones that are ending up in the hospital.
So I always look into, that there is a number of cases that are increasing because more testing is done. But I look into the number of hospitalizations that are happening, and then number of deaths that is happening. That kind of gives me a little bit better gauge. What do you think?
Absolutely, because you have to understand the patients that are sick from COVID-19, we hope that they survive and they do well, but the high degree, they are that sick that they might not do well. So those are your death counts going up. The number, are they COVID related or are they COVID unrelated because they've been quarantined themselves and they're getting sick from other reasons. So yes, you have to look at the admission rate. Are they COVID related, true COVID related admission rate? And that would tell you the surge and the probability how bad it's going to be.
Right, that's what I meant, that COVID hospitalization and that COVID death, that the number I look more than number of tests that is happening. So in conclusion, I mean, is it right to say that virus is highly unpredictable? We don't know how it mutates. It may mutate for a better, it may mutate for a more severe form. We are still working on the vaccines and treatment. So right now, the best strategy that we can do is prevention is better than cure. Practice good social hygiene, infection control, hand washing, disinfect the surfaces that we use, wear mask if we need to go out, social distancing that we can do. Also hydration, better diet, exercise, take care of ourselves so we can, exercise is a great form of immunity. I always say it's the cheapest medication, but highly underutilized. What do you think?
Absolutely, because knowing that if you take care of yourself, knowing that if you are COVID positive and you isolate yourself in hydration, nutrition is great, people end up doing great, And in conclusion, I would like to say that this is something to take it seriously. People who are not taking serious the social distancing, the mask, the protective gear that people need to wear, what CDC recommends, they need to take this seriously, because you may not get infected, you may not get the symptoms, but everyone lives with someone, and we don't know how their immunity is and what do they come down with.
And then there are cases where the younger ones have also come with symptoms later on. We had seen the parties at the beaches, and we have seen cases, and then we have seen so many people affected and being in the hospital.
Absolutely. And I understand world needs to open back up, which I understand, people need to go back out working, but it just needs to be with precautions. People need to take very good precautions in doing this. Things that we do in the past, we're not, like you said, exercising. With this COVID-19, I realized that I'm doing more walking every day than I've ever done in my life, because I want to protect myself as my family too. So we always are walking about 2 miles a day, just so at least we stay healthy.
And plus, social distancing does not mean social isolation. So connect with people, connect with friends, connect with family. And one of the things was that touching and feeling, that also stimulates our skin, and we get some good hormones released that are preventable, helping us. But I think by socialization, adapting to what the need of the time is, we can do all of those parts. So
absolutely. And
so it's still hygiene, hand washing, mask, social distancing, connecting with people, good exercise, sleep, avoid stress. Vitamins, minerals, what's the roles? A lot of people say vitamin C, vitamin D, this and this and that.
So recommendations always multivitamin, but we've used quite a bit of zinc in the patients that we've been seeing. So we do use zinc quite a bit. So definitely, yes, I would highly encourage vitamins, multivitamins.
Any last thoughts?
No, just be careful out there. It's a different time, different world. My wife and I constantly talk about how things are going to end up and what we're seeing as things are opening up. Just be careful out there. If you don't have to go out, don't go out. If you could stay home, stay home.
So we'll not be back to normal. It will be new normal.
The new normal
coming out. So life in our life in the coronavirus pandemic, lockdown, reopening, fact, fears, and some prevention. Thank you so much, Dr. Ali, for joining.
Absolutely.
Thank you. Your time. Thank you. God bless.
Take care.